You do have a copy of my.
All right, good morning, everyone. Thank you all for being here. I am going to start by departing a little bit from my usual instructions because I think there is just something important that I need to clarify for the benefit of the public. And that is the name of the applicant. So, counsel, I just wanted you to identify yourself for the record.
Adam Rose.
Thank you. So prior submissions have at various times referred to the applicant as being Lift Wellness Group, Mary Dobson, or Dennis Dobson, or Dennis Dobson. So OHS in turn has labeled certain documents with those names, but I understand from a letter you submitted a couple days ago that the name of the applicant is in fact Lift Pathways to Renewal, LLC. Is that right?
That is correct.
Okay, thank you. So now that we have that taken care of, I'm going to sort of jump back into my usual instructions, but I did think that that was important to get out of the way for the benefit of the public. So Lift Pathways to Renewal, LLC, that's the applicant in this matter, seeks a certificate of need for its proposed establishment of a new healthcare facility pursuant to Connecticut General Statutes, Section 19A-638, sub A, sub 1. Specifically, it seeks to add certain mental health services, specifically partial hospitalization and intensive outpatient programming. That's PHP and IOP at its existing facility in Westport, Connecticut. Today is May 24th, 2023. My name is Daniel Chuka. Dr. Deidre S. Gifford, the Executive Director of the Office of Health Strategy, designated me to serve as the hearing officer for this matter, to rule on all motions and to recommend findings of fact and conclusions of law upon completion of the hearing. Public Act number 21-2, as amended by Public Act number 22-3, also authorizes an agency to hold a public hearing by means of electronic equipment. In accordance with this legislation, any person who participates orally in an electronic meeting shall make a good faith effort to state his, her, or their name and title at the outset of each occasion that such person participates orally during an uninterrupted dialogue or series of questions and answers. We ask that all members of the public mute the device that they are using to access the hearing and silence any additional devices that are around them. This public hearing is being held pursuant to Connecticut General Statutes, Section 19A-639A, sub F, sub 2. Although this does not constitute a contested case under the Uniform Administrative Procedure Act, the manner in which OHS conducts these proceedings will be guided by the UAPA provisions and the regulations of Connecticut state agencies. I do have some OHS staff with me here today to assist in gathering facts related to this application, and we will be asking the applicant witnesses questions. I'm going to ask each staff person assisting with questions today to identify themselves with their name, spelling of their last name, and OHS title. And I'm going to begin with Steve Lazarus.
Hi, good morning. Stephen Lazarus, Lazarus. I am the Certificate of Need Program Supervisor.
Thank you. Now, Jessica Rival.
Good morning, Jessica Rival, RIV as in Victor, AL, and I'm a healthcare analyst with the Office of Health Strategy.
Thank you. And Ms. McLaughlin.
Good morning, Yadira McLaughlin, MC, capital LAUGHLIN, and I'm a planning analyst with Office of Health Strategy.
Also present, sort of in the background, is Faye Fentis. That's spelled F-E-N-T-I-S. She's a paralegal with our agency. She will be assisting with the hearing logistics and will also gather the names for public comment later on. The certificate of need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicant, members of the public, and our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during these proceedings. This hearing is being transcribed and recorded, and the video will also be made available on the OHS website and its YouTube account. All documents related to this hearing that have been or will be submitted to OHS are available for review through our Certificate of Need portal, which is accessible on the OHS CON webpage. In making my decision, I will consider and make written findings in accordance with Section 19A-639 of the Connecticut General Statutes. Lastly, as Zoom notified you in the course of entering this hearing, I wish to point out that by appearing on camera in this virtual hearing, you are consenting to being filmed. If you wish to revoke your consent, please do so by leaving the meeting at this time. So the CON portal contains the pre-hearing table of record in this case. At the time of filing yesterday, exhibits were identified in the table from Exhibit A to Q. Mr. Lazarus, Ms. Rival, Ms. McLaughlin, and Ms. Fentis, do any of you have any additional exhibits that you wish to enter into the record at this time on behalf of the agency?
I do not.
Not at this time.
I do not.
Okay. And Ms. Fentis?
I do not.
Okay, thank you.
Uh,
The applicant is hereby noticed that I am taking administrative notice of the following documents: the statewide healthcare facilities and services plan, the facilities and services inventory, the OHS acute care hospital discharge database, the all payer claims database claims data, and the hospital reporting system financial and utilization data. I am also going to be taking administrative notice of the following dockets. And Attorney Rose, if you need me to slow down, just let me know.
Thank you.
22-32513, that -CON. That's actually an application that you asked me to take administrative notice of, I believe, in your response to the issue responses. That's regarding Norwalk Hospital. Docket number 19-32305-CON. That's CTYA Services, doing business as Newport Academy. And that again was referenced in one of the applicant's submissions, not by docket, but by name. 17-32197-CON. That is the application by Discovery Practice Management, DBA Center for Discovery, Greenwich. And then finally is 15-32042-CON.
I'm sorry, can you repeat that number again? 15-04.
15-32042. That's Center for Discovery, Southport. So starting with the exhibits as they are identified in the table of record, and also all of those records that I just mentioned that I was taking administrative notice of. Attorney Rose, do you have any objections to any of those documents?
Well, if it's for our benefit, I don't need the agency to take administrative notices of all the dockets except for Norwalk Hospital. The other ones, if you need to, in considering the application, take administrative notice, then I won't object. But if it's for our benefit, I would ask that those be removed. And I think we would rather that you limit your review to the materials that we submitted, but then also include the pending application for Norwalk Hospital.
Okay. I think that given some of the statements that were made in some of the submissions, that looking at those may actually be of some benefit to us.
Okay,
Just because there's some information in there in terms of like what Newport Academy was expecting in terms of utilization and the types of services that they were planning to offer, and how those may interweave with what is being applied for here. And yeah, my preference would just be to take administrative notice of those. And if I don't end up relying on them, then I won't end up relying on them. But I do think that some of the information in there could be helpful for this one.
okay.
Um,
Now, one other thing, Exhibit G has public comments, and you indicated that that exhibit will be updated as more written public comments are received. Currently, there have been some individuals who have sent us letters that we understood would have been submitted to the agency as comments, and we've tried to just sort of redirect them. I have a question: if we have letters in our possession, if we continue to try to redirect individuals to submit them via email to the CON comment@ct.gov, how much time do they have to do so? And if for any reason we can't do that, can we submit those letters that we have in our possession that are directed to you as the hearing officer in this proceeding? Would we be able to upload them to the portal and have them either A, be considered comments, or if not, B, letters of support?
So the way we have been doing this recently, and for anyone else who happens to frequent these CON hearings, it's probably to their benefit to know this as well. We've been separating out public comment that has been submitted prior to the hearing versus public comment that has been submitted after the hearing or during the hearing. So we will consider everything that is being submitted. And in this particular instance, we're going to allow written public comment to be submitted up to 7 days following the hearing. The only reason for separating it is because when I speak with counsel and I say, do you have any objection to anything that's been put in the record? I want it to just be clear what has existed prior to the hearing and what is after the hearing. So yes, you can continue to submit things up to 7 days following the adjournment of the hearing. And the other thing that I wanted to ask you was, so are you saying that some of the comments that have been submitted either by you or your client haven't been added to that Exhibit G yet?
So there are letters that were shared with us where somebody says, here you go, here's a letter directed to the hearing officer in the proceeding, and these are letters that are in support. For a good number of them, we've been able to get back to that individual and have them then resend directly to the agency, and they have made their way to Exhibit G. Some of them have not. And so these are busy people, honestly. We are so grateful to the people that took the time to write these letters. And I just want to make sure that, if somebody's schedule doesn't afford them even 5 minutes to pay attention to email it to the CON and it's in our possession, whether we could just upload it to the portal ourselves, because these are letters signed by them directed to you.
You can do that. My suggestion, though, would be to forward those letters to comment@ct.gov instead.
Got it.
Just so that we can organize them however we think we need to. But yeah, anything submitted after right now will be considered up to 7 days following the hearing.
Much appreciated.
So given that, all identified and marked exhibits are going to be entered as full exhibits at this time. Attorney Rose, do you have any additional exhibits that you wish to enter at this time?
Not at this time. Thank you.
Okay, then, we will proceed in the order established in the agenda for today's hearing. I would like to advise the applicant that we may ask questions related to your application that you feel have already been addressed. We will do this for the purpose of ensuring that the public has knowledge about your proposal and for the purpose of clarification. I want to reassure you that we have all reviewed your application, the completeness responses, and the pre-filed testimony, and we will do so again before issuing any decision in this matter. As this hearing is being held virtually, we ask that all participants, to the extent possible, enable the use of video cameras when testifying or commenting during the proceedings. All participants should mute their devices and should disable their cameras when we go off the record or take a break. Please be advised that although we will try to shut off the hearing recording during the breaks, it may continue. And even if the recording shuts off, the video and audio may still continue as well. If the recording is on, any audio or video that has not been disabled will be accessible to the participants. Public comment taken during the hearing will likely go in the order established by OHS during the registration process. And right now we have designated the hours of 2 p.m. to 3 p.m. as the public comment sign-up period. Although I may allow public officials to testify out of order, that'll probably be the only ones who I allow to testify out of order today. I or OHS staff will call each individual by name when it is his or her turn to speak. Registration for public comment, as I just mentioned, will be from 2 to 3 p.m. today. If the technical portion of this hearing has not been completed by 3 p.m., public comment may be postponed until the technical portion is complete. Moreover, if we end the technical portion early, we cannot take comment earlier, given the way in which the hearings have been noticed. So there will be a break between the technical component and the public comment component. Regardless of when it is, the applicant's witnesses should be available after the public comment, as OHS may have additional follow-up questions based on the public comment itself. Attorney Rose, are there any other housekeeping matters or procedural issues you wanted to address, or any questions you had at this time?
A couple notes about Dr. Alyssa Bennett, who will be testifying on behalf of the applicant and has submitted pre-filed testimony. The first is that I've been warned that there may be times during the proceeding where she may breastfeed her baby and would like to turn off her camera, even if she's fielding a question. We don't expect that to line up time-wise. And so in terms of just having her camera on, if you want us to defer a question, if her camera is off and she's going to be the appropriate individual to answer a question, then you could either wait or she could just respond via audio only, if that's acceptable.
That's acceptable, and I see her in the Zoom, and her name is very clearly there. So if she is testifying, I think it'll be pretty clear who's speaking.
Okay.
So that's fine, even if her
Thank
video
you.
is off.
Yeah, thank you for that. And also Dr. Bennett, it has, as you can imagine, she has a pretty packed clinical schedule, and we appreciate that she's taken the time, and I've advised her that she needs to be here for the technical portion of this. And I'm confident that the rest of the applicant's staff will be able to field any questions should they arise after the public commentary. So I just wanted to clarify whether it would be acceptable if Dr. Bennett not have to hang around and field any questions after public commentary.
Yeah, that's totally fine with me.
Thank you.
All right, so we're going to move on to the technical component now. Council, do you wish to make an opening statement?
So I'm going to try to make this brief because you're going to find that Mary Dobson is incredibly passionate about this project, and it's almost comical trying to work with her on her opening statements in this because there's so much that she wants to say, and I have to explain to her that the purpose of the proceeding is to make sure that there's enough information submitted to the agency to satisfy the statutory criteria so that we may responsibly obtain approval to move forward. And that's something where in coming into this application, I review the application, I work with the applicant, and one of the first things that strikes me in this particular instance is that the clear public need for additional mental health services, specifically at the IOP and PHP level, is extraordinary. And I'm saying that from my observation of the statistical data that it's been compiled and submitted to the agency. I also note that there's been a lot of diligence, particularly in response to the hearing issues, of analyzing the providers that exist to service that need, and more specifically, the lack of providers to service that need. So in my estimation, there's a dire need for this proposal. And then the fact that it's grown organically out of an existing practice that's run by the clinician who's actually sitting down with the patients and understanding the needs and feeling the frustrations of trying to move beyond a group practice setting to find IOP and PHP care for these individuals and facing the exact challenges. So from that perspective, I hope that there is an appreciation that this is a special application where you're not looking at, a national chain or any other type of entity setting that is just looking to profit, because ordinarily I represent nonprofit behavioral health providers by and large. And I appreciate that there are exemptions to the certificate of need process for those nonprofit entities, particularly those with the state contracts supported by DEMIS. But this particular applicant, while being for profit, is really a passion project of an individual clinician. So this is not an institutional entity looking to enter the state. This is an individual who, you'll see from the pre-file testimony, began her journey with actually suffering from the type of ailment that she currently helps other people overcome. So as I said, you're gonna see a lot of passion, but I hope that you also understand that that passion does not get in the way of Mary Dobson's current practice that she runs with her husband, which is incredibly successful. And I think you'll see from the public letters of support, she is so plugged in and everybody appreciates what they do. They are financially responsible and they are coordinated with other providers as shown by that support. So I think in terms of the state feeling like there's a need for these services to alleviate pressure on inpatient facilities and residential facilities, to be able to have a safe place to step down patients, reduce cost of care, increase quality and comfort for patients. This couldn't be a better setting and application. So what I'd like to do today is keep my client focused as much as possible on answering your questions, to be able to laser in on giving you whatever information you as the agency feel is necessary to responsibly approve the application. And with that, I'll turn it over to Mary.
Thank you, Adam.
But before we start with you, Ms. Dobson, I do need to swear you in. So can you please, and Attorney Rose, so you have Ms. Dobson, you have Dr. Bennett. Are there any other individuals you plan to have provide testimony today?
Yes, I do. So the applicant currently utilizes an external consultant to help with this project. And while we didn't need him to provide affirmative testimony, he is an individual that may be necessary at times to help us respond to questions related to the application. His name is Tim Davis, and he's waving. And in addition, if necessary, Dennis Dobson is here in the room with Mary and I currently, and he will serve in the same capacity that if there is a question that we feel pertains to the application, not any testimony, that he would be appropriate to answer, we'd like him to be able to do so. And so if you want those individuals to get sworn in, I'm going to zoom out. Oops. I'm going to try to zoom out. There's Dennis.
So since you two, Mr. and Ms. Dobson, are in the same room, I'm just going to swear you in at the same time. And then if Dr. Bennett or Mr. Davis need to provide testimony at any point, I'll swear them in separately since they're in different locations. So Mr. and Ms. Dobson, can you please raise your right hands? Thank you. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided in your pre-file and the evidence that you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do.
I do.
Okay, thank you. So Ms. Dobson, I understand you were planning to make some preliminary comments. Do you adopt your pre-file testimony?
I do.
Okay, and you can begin whenever you're ready then.
Okay, thank you, Daniel. Thank you, everyone, for being here today. And I just want to start by saying I'm tremendously honored and humbled to appear before you today to personally present my application for the certificate of need. Shall I get started? My pre-file.
Oh, I'm sorry. You wanted your pre-file. Dennis? Yes. Can you pass me the piece of paper that's underneath that paper? The written opening statement, Mary. Oh, no, you just have to say, I hereby adopt my pre-file.
Oh, okay.
And then this whole thing that you
Okay.
submitted is done. And then
Oh, I
you're
don't read it.
that's correct.
Okay.
You don't have to read the whole thing.
Okay.
You just say, I hereby adopt it.
Oh, okay.
And then you can give any other statements
Okay.
that you have prepared to be able to summarize
Okay.
what's an application and why you think it should be approved.
I read the whole thing. Okay. So just to introduce myself, my name is Mary Dobson. I'm a licensed marital and family therapist here in Connecticut. I've been in practice for about 15 years. And I'm also a certified eating disorder specialist. I have a practice called Lift Wellness Group, which is a community counseling practice local to my area. And what I'm here to talk about today is improving community access to care by offering quality and accessible intensive outpatient and partial hospitalization services for individuals in the state through the introduction of my new organization, Lift Pathways to Renewal. I'm here on behalf of my clients. I'm here on behalf of the area clinicians that I work with every day. And I represent them today when I ask for this application to be approved. I am a working clinician within my company. I see around 20 clients a week in addition to overseeing leadership and aspects of programming at Lift Wellness Group. And I believe that the addition of IOP PHP services that we propose today will be a cost-saving measure for the state and also bring a tremendous amount of value to the area providers who are strained in working with these acute cases, and also be appreciated by the local community. And I'm very thankful for all the letters of support that have been submitted to the state. And I believe there are more of those to come. So thank you very much for being here, and I appreciate your time.
Sorry. Thank you, Ms. Dobson. I was on mute. Attorney Rose, did you have anyone else who you wanted to make
Yes.
some preliminary statements?
Yeah, so Dr. Bennett's going to make a preliminary statement, and then to reiterate, Dr. Bennett, you need only say, I hereby adopt my pre-file testimony. Okay.
Good morning, everyone. My name is Dr. Alyssa Bennett. I'm an adolescent medicine physician at Connecticut Children's. I hereby adopt my pre-filed testimony.
Thank you.
I'm here today really to answer any questions you have in my capacity as the designated medical director of Lift Pathways to Renewal, LLC. As we've discussed already, we feel there is an urgent need for additional mental health and eating disorder treatment for teens and young adults in Connecticut. And I urge you to approve this application to help improve access to such care. And again, thank you all for having me today.
Thank you, Doctor. Attorney Rose, anyone else?
Nope, that'd be it.
Okay. So we're going to keep moving forward, and we're going to move on to the question by OHS staff. Let's see. Before we do that, though, I did just have one question that I wanted to ask, and I may interject here and there with my own questions. We just try to have this be as organic a process as possible. So if I need further clarification on something, then I'll jump in. At some point in your application, it just says Lift Wellness has been operating in Westport since 2009. Has it actually been in operation since 2009?
Thank you for that question. I noticed that in review of the application last night, the Lift Wellness Group has been in operation since 2009, but it was previously not in Westport. We have been in our Westport location since 2021. Yeah, so that was a misprint. It should have been 2021 in Westport.
In Westport, but
In Westport.
but
We've
I think,
served the Westport area since 2009.
so to simplify,
Yeah.
I want to clarify the question. So you simply, your question doesn't pertain to geography. You just want to know, has Lift Wellness Group been providing services since 2009?
Correct.
Yes.
Okay. Yes.
So the reason I ask that is in trying to sort out the corporate structure and the corporate names, I did a Connecticut business search, and Lyft, according to Connecticut business search, has existed since January of 2017. So I'm just trying to get some clarification on the 2009 and 2017 differentiation.
So Woodland Psychotherapy Group was the original name of Lift Wellness Group. We DBA'd as Lift Wellness Group, and then we eventually changed our name to Lift Wellness Group. So the original name of my practice, initially it was just me. I was a sole provider. So I was a sole provider, and then we established ourselves as Woodland Psychotherapy Group. And then changed our name to Lift Wellness Group when we rebranded our marketing materials.
Okay. that,
the
that,
practice year.
that helps me. Thank you.
Yeah.
So that's the only preliminary question I have. I'm not going to now turn it over to Jess, Yadira, and Steve to ask you some questions. So Ms. Rival, Ms. McLaughlin, I don't know who's starting, but whenever you're ready.
Good morning. Could you please describe the current services offered by Lyft and the need for these services in the primary service area?
Yes, so Lyft Wellness Group is an outpatient community mental health practice, and we treat the full range of mood disorders and community mental health. Lyft Pathways to Renewal, the applicant, is intended to be an intensive outpatient and partial hospitalization program, which treats mood, anxiety, and eating disorders.
Okay. Can you describe how expansion into IOP and PHP services will benefit the identified population?
Yes. I have been working in Westport, overseeing my practice Lyft Wellness Group, in addition to working in the field of eating disorders for some time and in mental health in Connecticut for some time. Our current population at Lyft Wellness Group frequently is too acute for our outpatient facility. And when we have clients who are no longer a fit for our level of care, and we wish to refer them, we have issues finding quality, accepting IOP, PHP services that are relevant to the services that they are, for the diagnoses that they're looking to treat. And this has been an issue for our practice. We internally have clients who require a higher level of care that we cannot accommodate. We also get a lot of calls for referrals that, you know, when we do an admissions conversation, we learn that they are needing a higher level of care, and they're not able to be accommodated. So that's the data that I speak from.
Thank you.
I can just do a quick follow-up on that. This is Steve Lazarus. So where are you referring the patients, or where are they receiving their services currently?
So we have well, I guess there's two separate questions there, right? So where are we referring our patients? Our patients, what we often will do, because we treat eating disorders and mood disorders, and when we have an internal client who requires a higher level of care, the family will often request that, you know, we flex our services and offer an additional individual session a week or an additional family therapy session a week, as opposed to utilizing the existing options that are present in Connecticut at this time, mostly due to clinical relevance and milieu appropriateness of fit, and also continuity of care with their existing treatment team, because we have relationships with clients that there's a disruption in care when there's a referral to a higher level of care, and then another disruption when they're stepping back down.
And what percentage of your patient population typically uses that avenue?
We've estimated around 30% of our current patient population has requested additional services with our existing treatment team.
And does that satisfy the patient's needs for that typically would receive at a IOP or PHP?
It
program?
doesn't. it doesn't satisfy, well, IOP PHP programs can be very focused on group work, but also provide a supervisory component, and that's good structure. The clinical satisfaction is met sometimes by having additional clinical services, but the supervisory structure and the ability to scaffold the family by having a place where the family is able to bring the child or to go and to have uninterrupted supervision and support, that's not able to happen. And so that's a missing component from, we're able to accommodate clinically somewhat the need, but it's not sufficient in the way of supervision and scaffolding that a day program provides. And also it's cost prohibitive. And that's the primary purpose for my request for IOP PHP licensure, is to be able to become credentialed with insurance, so it's not cost prohibitive.
Thank you.
Exhibit A, page 44, table 11, shows that the Center for Discovery in Southport is closed. However, the website still shows that the center is operational. Can you explain this?
The Center for Discovery in Southport was shuttered for a period of time. I believe it was shuttered while we wrote the application and submitted it in November. I'm
confused. I'm sorry, I was looking for the page and so, so in the application, it was indicated that. All right, well, tell me
Yeah.
what you know.
Yeah.
She's saying it is closing.
I have it on good authority that it is closing. It hasn't, I don't believe it's been made public yet.
Ooh. Well, we made it public in our application.
Well, it was shuttered, but now it's actually,
Oh, okay. But, all right.
it hasn't been performing well, and they've been doing virtual services as opposed to in person.
Okay, so just to clarify, they shuttered their services for a period of time while you were writing the application. They have since reinstated services. It sounds like virtual services, but they are still planning to close. Is that correct?
The therapeutic community has been informed that it appears as though they are closing.
Okay.
But that's their announcement to me.
Understood.
Can I interject? Oh, sorry, I'm sorry to interrupt you. I just want to get clarity on how to refer to the page numbers. I was having difficulty because there's a page number at the lower left that shows like a tiny page number, and then there's a page number at the lower right that's a much different number. I've been going on the lower left numbers. But when I refer to page 44 of Exhibit A, I'm looking at an affidavit.
May I jump in?
I'm pulling it up right now.
Adam, it's on page 30 on the lower left.
30 lower left. Okay, so we are using the lower left page numbers just so we're coordinating, so when we're flipping around. Got it.
Okay.
Thank you. Sorry to interrupt.
No problem. Can you describe what intensive outpatient psychiatric services and partial hospital services would look like and compare them with the current services at LIFT?
Yes. So LIFT does not offer intensive outpatient partial hospitalization services. We're an outpatient practice. We, as I mentioned, sometimes will add in additional outpatient therapy sessions for a client who is dealing with high acuity. What I propose to do with LIFT Pathways to Renewal is a traditional IOP PHP program. We have several licenses that we're pursuing, 10 to 18 and 18 plus. We also have been in conversation with DCF regarding DCF licensure for 10 to 18. We'll be pursuing that as well. So we plan to pursue all of the appropriate regulatory standards for IOP PHP for the higher level of care.
Could you explain exactly what PHP and IOP services are and what the
Yeah.
differences between them?
Yeah, so IOP services for mood and anxiety and for eating disorders constitute 3 to 4 days per week, 3 to 4 hours at a time, 2 to 3 groups per day, partial hospitalization, 4 to 5 groups per day. And the IOP level of care for what we're proposing and Lift Pathways to Renewal would be 1 to 2 individual sessions per week, 1 to 2 family sessions per week, 1 to 2 nutrition sessions per week, medical monitoring, psychiatric care. I mentioned group therapy, and so the IOP PHP is largely defined by the amount of hours that someone spends at the facility.
Thank you. Will there be more than one IOP or PHP program?
Right now, we're just looking at licensing Lift Pathways to Renewal, which will be in our existing space in Westport. We operate out of a historic home building called Richard's House. It's on the main road in Westport on Myrtle Avenue. It's a a home that was actually, it used to be a school for boys, and we've renovated it. And the second floor is where Lift Wellness Group is. We have access to the first floor as well. I'm getting into a triple net lease on the building with the building owner, and so our plan is to complete renovations on the first floor and have the first floor be the location for our IOP PHP program.
Is there going to be different programs for adult and children?
There are 2, so we're pursuing the IOP. I think it's it's in the application, but we're pursuing the licensure for children 10 to 18. And then we're also pursuing licensure for adults 18 plus for IOP and partial.
And are there any plans at this time to expand the services?
At this stage, my focus is on making Lift Pathways to Renewal the best that it can be, and utilizing the team that we have. I myself and some of the folks that are sort of passionate parts of my existing outpatient program, my leadership team, who share my passion for starting IOP PHP level care.
So when she asks a question that can be answered yes or no, if you take a moment and then if the answer is no, we're not going to expand,
Right.
then you can leave it there.
Yeah.
So just to make sure she gets her answer when it's a yes or no question.
Oh, I see.
If you just say, are you planning on expanding further
Yeah.
beyond IOP PHP? If the answer is no, just go ahead
Yeah.
and give her a no.
I would love to if our primary location is worthy of replicating.
Okay, thank you. Exhibit A, page 10 reads, Lyft has begun providing longer programming, group therapy, and multi-hour sessions during the day for acute clients in need. However, these clients need true IOP or PHP programming and would also benefit from a licensed program that could accept payment from commercial insurance or Medicaid programs, not just cash pay. Just to clarify, are patients currently paying out of pocket when they get those extended treatment services?
Correct,
No,
yes. Yeah, we are a self-pay practice. We are a self-pay outpatient practice. And if we are going to pursue licensure for IOP, PHP, we wish to make it accessible for families to be able to utilize. And so it will be absolutely necessary to be in network with all of the insurances.
So that's your plan, is to become in network with Connecticut's main
Yes.
insurers? Okay,
Yes.
thank you. How are patients going to be notified of the new outpatient treatment programs that'll be available?
We have a newsletter which we utilize to update current and former clients of any new information. We would also utilize local marketing, and I have very strong relationships with all of the area pediatricians, physicians, psychiatrists. And so those folks have already expressed the strong need for a higher level of care, specifically provided by my team, which has been deemed, a pretty exceptional team. And so they've expressed their support and their encouragement to pursue this licensure, and that they would refer.
Okay.
Do you expect there to be any outreach to some of the local hospitals, Norwalk Hospital, Bridgeport, St. Vincent's?
Absolutely. Relationships with those hospitals will be critical, because we will be accepting step-down clients.
Page 5 of Exhibit I states that we estimate that Lyft turns away 4 to 6 clients a week in need of more acute care than they're able to provide. What are these? Well, you explained the patients are currently receiving extended services through you, even though that's not sufficient. But do you keep a record of these requests for services for something that would be equal to IOP or PHP?
Not really, no.
Do you have any estimates on about how many people you have to turn away for services because you don't have the appropriate service for them, the appropriate level of care?
It would be hard to answer that question with a numeric. It's anecdotally, it's the weekly, we have people that we have to turn away. It's variable, but it's a consistent theme.
Okay.
But if you do document, yes, but
Yeah, we do.
Exhibit A, page 18 states that we will look at contracting with Medicaid and becoming an in-network provider. Has or will Lyft committed to becoming a Medicaid provider?
Lyft is to Renewal will be pursuing credentialing with all of the insurances, including Medicaid.
So I have a follow-up on that, and Ms. Rival, you may ask, or you may have been planning to ask this anyway, but there's a difference between becoming a provider for Medicaid and actually servicing the Medicaid populations. So is Lyft able to commit to like a certain percentage of its IOP or PHP patients being Medicaid patients?
I would imagine so, yeah. Lift Pathways to Renewal would be able to commit to taking a certain percentage of Medicaid patients, yeah.
And this sort of relates to a question that was asked earlier in terms of outreach. What sort of efforts will be made to ensure that you try to service the Medicaid populations as best as possible in your area?
I would imagine having the information clearly stated on the website, putting a newsletter, announcement out. We also have tremendous collaboration with the area physicians and pediatricians who treat a number of Medicaid patients within their population. So they would definitely be referring those patients our way.
Okay, thank you.
Exhibit A, page 18, states that LIFT's charity care policy will A, provide free care for 2 individuals per year from local and underprivileged communities, and B, provide a 20% discount on the standard hourly fee for IOP and PHP individuals who are 50% below the median income of Westport. How many patients have utilized the charity care policy in the last 3 years?
So we take 2 per, I believe it's 2 per quarter you're referring to Lift Wellness Group?
Yep.
That would just be a calculation. It's always utilized. So two per quarter for 3 years.
Per quarter as opposed to per year?
I believe it's per quarter. Yeah.
Okay.
Yeah. It's on our website as well.
Okay. Have any patients ever been denied services due to their inability to pay? And if so, how many?
Well, we've never denied a patient services, but I'm sure that there have been patients who didn't find us to be the right fit for them because of cost. And that's one of the reasons why we're seeking to open an in-network program.
And is there an appeal process when it comes to your charity care policy?
We don't have an existing appeal process, but we've never needed to utilize it.
Okay, thank you. That concludes my questions. Yadira?
I wanted to do another follow-up on that. I recall reading that you offer scholarship treatments at some point to indigent populations. Actually, you know what? Never mind. I feel like your answers and the submissions have offered enough clarity on that. So Ms. McLaughlin, you can ask your question.
Okay, thank you. Good morning again. What is the average daily cost of treatment for a client in the IOP program? And then just so you know, I'm also going to ask the same question for the PHP program. So what is the average daily cost of treatment for clients in the IOP program and in the PHP program?
May I take this one, ma'am? This is Tim Davis.
Sure, yes.
Sure.
Well, before you start, Mr. Davis, since you are going to be testifying, I do need to swear you in.
Of course.
So please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury?
I do, yes.
All right, thank you, Mr. Davis. You can proceed.
Yeah, so for the projections in the materials we've submitted, we estimated $125 an hour for both IOP and PHP. The difference being IOP is 3 hours a day for about 3 days a week. It can go up to 5. and PHP goes 4 to 6 hours a day, normally 5 days a week. So that 125 an hour was kind of the base estimate that we used to build all of those financial metrics. A little bit more color insurance. It's a little bit more wide ranging, but that's the cost to the insurer more than the family in terms of what they actually pay reimbursement.
Okay, thank you. And please discuss your responses to OHS's tables 3 and 4 on page 19 of Exhibit A, the application. So we're looking at page 19 of Exhibit A.
Gotcha. And these are the average cost per self-pay patient and for commercially insured patients?
Correct.
Okay. Yep. And again, we used the same estimates, and these numbers were, for the projection for the year, these were done in November, not knowing when we might be able to open. So these we've updated a little bit in some of the new materials. But again, we use the 125 an hour per self-pay patient. That would be for 3 hours of IOP or 4 to 6 hours per day of PHP. For commercially insured patient, again, we use the same estimate because it's a pretty good median range for what insurance reimbursement is for those levels of care.
And describe the referral process. Thank you, Tim. Describe the referral process for the 2 new services. How will patients be appropriate for these services? How will patients appropriate for these services access care?
So we have a very strong referral base in the community at Lift Wellness Group, the outpatient practice. Given that we are opening a insurance base, or we seek to open an insurance base IOP PHP program, Lift Pathways to Renewal, the referral streams that we have will likely remain consistent. Accessibility will just increase.
Okay, thank you. And does Lyft have any referral agreements with local hospitals, any other local providers for IOP and PHP levels of care?
When you say referral agreements, what does that mean?
So have you pretty much cemented any agreements or anything with any hospitals once they discharge a patient? Do you have anything in writing that they will agree?
May I take that one again?
Yes.
The hospitals can't sign anything in writing until we're a licensed provider for those services. But Dr. Bennett's here to testify about the need that she sees in her hospital and the good relationship they have with Mary, that they already refer patients for lower levels of care. So we expect the trend to continue once we're licensed and able to get those documents.
Okay, thank you. And how about any transfer agreements? Does Lyft have any transfer agreements with hospital in the proposed service area for emergency treatments?
We don't.
I mean, if you want to say.
We plan to pursue transfer agreements with all of the, area hospitals for
Thank
Lift
you.
Pathways to Renewal.
Okay, thank you. And can you explain Lyft's treatment model and its connection, if any, to any national or industry-wide standard or practice guidelines?
When you say Lift's treatment model, are you referring to Lift Wellness Group or Lift Pathways to Renewal, the applicant?
The applicant.
And when you say treatment model, do you mean to compare and contrast what we're proposing to do compared to what's out there right now?
Correct.
Okay. So the reason why I am proposing Lift Pathways to Renewal is because I'm a licensed marital and family therapist. LMFTs believe in systems theory, that people are the product of their family environments and the societies that they live in, and that those environments shape the individual. So eating disorders and mood disorders are, of course, biologically based, and the data for that is established. But the family services component is a missing component from the majority of our competitors. The existing treatment options out there do very little in the way of family services. And what we propose to do is provide family services, family-based services, which is sometimes called the Maudsley method. It's a particular form of eating disorder treatment, and also utilize various modalities of family therapy in intervention with patients. For example, narrative family therapy, psychodrama, family systems work, structural strategic family therapy. The rationale for that is that when an individual is identified as the individual, the identified patient, but the family system isn't taken into consideration, there generally isn't a lot of preparation or parent coaching on how the family can assist the client in their recovery while they're at IOP, PHP, and when they step down. So the family piece is really integral, the family intervention service component. That's going to be a differentiator between LIFT Pathways to Renewal and the other programs that are out there. Another thing is that I think that IOP, PHPs that are freestanding are very invested in getting people better and returning them to their home environments and utilizing community supports and natural environmental supports, whereas IOP, PHP programs that are attached to residential centers may not be as invested in returning individuals to their natural community support and keeping recidivism at a low.
Thank you.
Actually, I just have a follow-up to that. Do you plan for LIFT Pathways Renewal to join in some sort of a national accreditation body for quality purposes?
Yes, we'll be pursuing joint accreditation, joint commission accreditation, yes.
All right, thank you.
Okay, thank you. And describe any care coordination services that will ensure patients remain connected to appropriate services from intake to discharge, including any follow-up care.
So we have a lot of existing relationships within the community because we have an established outpatient community mental health practice with existing relationships to the town of Westport Human Services, the area schools. We spend a lot of time in all of the area schools providing psychoeducation and other resources. We have an admissions team that assesses and provides assessments at intake and then again during treatment. And so with discharge plans for LIFT Pathways to Renewal, I would imagine that some of the individuals who are being discharged from Pathways may be able to be seen at LIFT Wellness Group. But we have a lot of relationships with area providers, many of which have written their letters of support of this facility today, who are able to accommodate outpatient clients from us.
Thank you. And my last question is Exhibit O, the financial workbook. Please explain or provide more detail on the total operating revenue and total operating expenses amounts shown between 2023 through 2026.
Yeah, I can jump in here again. So, for the total operating revenue, we're again using that 125 per hour. We use the utilization table provided in the new submission that shows our projected number of clients. For these revenue numbers, we went conservative and we estimated that the whole adolescent population would just be IOP. And you see the splits in that utilization table for both adult PHP and IOP. We kept the PHP numbers very low. They tend to be your highest revenue generating clients, but we wanted to be conservative on the estimates. But the numbers for total revenue match the utilization that we expect month to month and year to year for growth in those programs. And again, we think those numbers are a little bit conservative, just because the demand we're hearing about from providers like Dr. Bennett and other local people, it may be higher. But that's how we got to the revenue. And then for the expenses down there, the largest expenses you're going to find are definitely in the salaries section. And it's having a therapist for each program. And then as the programs scale, making sure that you can provide aids to support the therapist. And once they pass a certain threshold, to add additional therapists. The contract cost that you'll see on there is for the psychiatrist and or physician to come by and see the patients maybe once a week or every other week. And then there's the normal, office supplies and stuff that goes into running a practice and making sure that the stuff is there every day, just to run a business and take care of clients. So if you have any other specific questions, I'm happy to tackle them on there.
Okay, thank you. That concludes my questions.
Thank you, Yadira.
Mr. Lazarus, do you have any questions?
No, I'm all set. Thank you.
Okay. I do have some of my own questions. I just want to take a short break. We've been going for a little while. I want to look through my questions to see if I really need to ask all of them. So let's come back in about 10 minutes. That'll be 10:52. So we'll do my questions, any follow-up by Attorney Rose, and then we'll probably sort of adjourn briefly, and then we'll come back later this afternoon for public comment. So I'll see everybody back in about 10 minutes.
10 minutes.